Hello everyone, myself Dr. Namrata Vithalani. In this video, we will discuss regarding the NYHA grading for the dyspnea. What is NYHA? It is the New York Heart Association classification system for the dyspnea. So basically, whenever we describe dyspnea, that is the breathing difficulty, and it is presumed to be of cardiac origin or it is related to the structural heart disease. When we describe, suppose even while history taking in cardiovascular system examination, if we describe, we are supposed to describe the patient's functional status. So basically, it denotes the patient's functional status in those having the structural heart disease. It is also useful for the comparison over a period of time. So first we will discuss the four grades and what is its clinical utility. So what are the four grades? So grade 1 is there is no limitation of functional status. Patient can perform the ordinary activity without having dyspnea, chest pain, fatigue or palpitation. So the symptoms of structural heart disease, they do not appear on ordinary physical activity. If one is going to perform activity more than the accustomed or the ordinary physical activity, he or she might have the symptoms. So the patient might be harboring the asymptomatic cardiac pathology. So what is the ordinary physical activity or accustomed physical activity for an individual? Suppose there are two persons. One patient is farmer by occupation and another is say for engineer who is having the sedentary lifestyle. Most of the time he is just sitting on the chair and working on the computer. So walking 5 kilometers continuously might not be ordinary physical activity or accustomed activity for him. If he performs that activity, he might be dyspneic at that activity, and that walking for 5 kilometers for another person might be an accustomed or ordinary physical activity. So ordinary physical activity or the accustomed activity for different patients are different, so we need to keep in mind. So patient if having grade 1 dyspnea can perform the ordinary physical activity and he will not be symptomatic during that. If he performs more than accustomed, he might have symptoms. Now what is grade 2? Grade 2 is mild limitation of physical activity. Patient is comfortable at rest, but while performing ordinary physical activity or accustomed activity, he may have dyspnea, chest pain or palpitation. That is the symptoms of structural heart disease. What is grade 3 dyspnea? There is the marked limitation of the ordinary physical activity. Patient is comfortable at rest, but whenever even less than ordinary activity also, that causes the dyspnea, chest pain or palpitation. Now what is grade 4 dyspnea? Grade 4 is patient is symptomatic at rest itself and he is unable to carry out the ordinary physical activity. So these are the four classes or four grades of the dyspnea according to the NYHA classification. Now how it is useful? Whenever we describe someone's pathology, so when the disease is advancing, say for initially patient was having grade 1 dyspnea, that when he or she performed more than accustomed activity, they used to be symptomatic. But now patient is having symptoms of heart failure, that he or she even dyspneic at rest and unable to carry out the activity. So it denotes some kind of complications. Say patient was having ischemic heart disease, but initially was having grade 1 dyspnea. So he was not symptomatic in ordinary physical activity, but now he is dyspneic at rest. That is the grade 4 dyspnea. So having the LV, might be having LV volume overload. So that suggests some complication or pulmonary congestion or volume overload, that patient is having symptoms of heart failure at rest. And similarly, someone who is having dyspnea at rest or LV volume overload, if we and might be requiring some form of ventilatory support. If we do the proper decongestion, if we give the diuretics, then the symptoms improved, then the patient is no longer dyspneic. So again, from grade 4 to grade 1, if he has responded to treatment, then it is also helpful to denote that initially patient on admission was having grade 4 dyspnea, that he was having dyspnea at rest, but now it is grade 1. He is on discharge, he is able to perform the ordinary physical activities. So over a period of time, whenever there is a progression of the symptoms, or even to denote the response to treatment, we can utilize the NYHA classification system. Thank you.